right, welcome back. Now, they say that the biggest achievement, the biggest investment you should have as a person is about your health. So how much do you take care of your health? Now, health begins at inception and it goes until one burns out. So it's a requirement that the biggest investment you should have as a person is to invest in your health. Now, we watched a feature about sickle cell and children or even adults undergoing the same disease, which is hereditary and is affecting many people. But the biggest challenge we have is the awareness, the treatment, and the sensitization across the country. And that is why today in studio, I have got Selina Olwanda, and Ogweno, who is the chairperson, Children Sickle Cell Foundation. Selina, welcome to the program.
Thank you very much.
Before we started the show, I was fanning myself with my paper, and you asked whether you should also fan yourself. I don't know why.
No, I thought that was the routine, but that's fine.
It's hot.
Yes.
Let's get into it. Sickle cell is, is one of the biggest diseases that is affecting many people.
Yes.
And the kind of awareness we have in the country probably is not getting to the grassroots level. From your own perspective, where are we as a country in terms of the awareness of sickle cell?
Yeah, good morning and thank you very much for this opportunity starting with. Sickle cell anemia is a genetic disorder, just like you've said. And unfortunately for many, they've never understood how it presents and also how to manage it. So many a times there are myths and misconceptions that have come around sickle cell for all those years, that people assume that sickle cell is associated to death. Some people even give a life limit to some people, like, oh, I hear people living with sickle cell can only go up to a certain age.
Yeah.
But that is where we lack the education, because when many people talk about people living with sickle cell live to a certain age, it means that the education level at that place is very low. So what we are doing is that to try and correct that, we are coming up as caregivers, we are coming up as people living with sickle cell and also families affected by it, to create awareness on sickle cell anemia and just remind people that it's not always about the life limit that you have, but it's about a full life that somebody can live, and actually a full life living with it.
You know, from your own, where you sit, it's a journey that many people walk throughout their lives. It starts from inception, the way you say it's hereditary.
Yes.
And it started many years ago. You find many people grappling with, but the biggest issue is the treatment.
Yes.
How do we get around it so that at the end of the day, yes, I know it's a condition that perhaps I need to live with, but I get proper treatment for me to live with it?
Exactly. So yeah, the story starts with also how I got into it.
Yes.
For all my life, I never met somebody living with sickle cell. I had one or two stories about them, but I never paid attention. That was in the 80s. And then later, in early 2000, mid-2000, I got my son. And my son was born with sickle cell anemia. Now, 5 years before that, my sister had a son who also had sickle cell anemia. But because he was diagnosed and told he has sickle cell anemia, there was not much follow-up done on that. So we assumed that, yeah, he has sickle cell, so what? It's like you're told you have malaria. Meza dawa, move on. So when it got to my son, it caught my interest. Like, how is it that we are getting children with this weird disease called sickle cell? We've never heard about it. I asked my mother, my father about it then. And my husband also asked his family, and nobody knew much about it. So later in life is when now, I think the next day after his diagnosis is when I met a doctor who actually explained to me how my son got sickle cell. But still, it didn't make sense. How can it inherit it from me when I don't even present with such symptoms? So we had to come to a place where he invited us to a support group and said, please come, meet this parent, meet these people living with sickle cell, is when you will understand better what I'm trying to tell you. And when I got into that place, I met people. One was in his 30s. I met mothers who have had multiple children with sickle cell. I met also some who had children with sickle cell, and they were all just figuring it out in that support group. Like, what do you do different than this other person that makes you live a better life than the other.
Yes.
And this is what called to my attention and many other caregivers. Like, we can do it differently. We don't have to always subject our children to the death sentence, which is actually not true. So through this Dr. Casey Wafula, he's the one who educated us. Every month he made sure we met, and we would sit and we would talk about sickle cell, and he would tell us what he understands about it, what we need to know about it, how to manage it from a home level, because it's not only the hospital that can manage sickle cell.
Yes.
As a caregiver, you need to be equipped in a way that this is what I should do to make sure my child does not fall ill.
What is the misconceptions about sickle cell? Because at the end of the day, you ask yourself and your husband that you did not present any symptom about sickle cell, neither does your husband. So what are the misconceptions?
Yeah, there are quite a number.
Yes.
Because of our backgrounds, especially because of the African setting, anything wrong starts from the mother's side.
Yes. Yes.
And that was one of the things.
You take the biggest brunt of any blame.
So we had to share that. The praises go to the father, the the bad things go to the mother. So many a times, many families blamed the mother. Maybe she did something in her past, or their family is of no good background. That's why their children are dying. Sickle cell affects the blood, and therefore anything that's related to blood, also we as Africans don't like talking about it. So they would say they're demon possessed. So maybe there's a demon that's sucking all that blood.
Yeah.
There are other things like something somebody did, a taboo that is following the family. There were other things that, because most of these kids were not living to see the age of 5. So many people used to think, this woman was cursed not to have children. And therefore you'd find that when the family starts having children with sickle cell, the husband would move to another family and starts getting children who maybe get healthier. Then he would believe the problem is with the mother. So those are a few of those myths. And then of course, things to do with just appeasing the gods. There are certain things you've not done in your life that make you be at that place. Go pray. Go pray till this curse is gone. So we've seen and heard quite a number of things that are very interesting. Yeah. And I believe the human mind evolves every day. So the stories change every day.
And you continue learning and realize that what the misconceptions and what you hear is not the case.
Exactly.
How did you come about? Because at the end of the day, there's something that pushed you to start the foundation. Because perhaps of the steps, whatever you went through, that now forced you to start a foundation that is helping children with the sickle cell. What is the rate of infection in the country as we stand? Probably if you have a data.
Okay. So first of all, I found the organization. The organization was formed in 2001. I joined it in 2005. And this was when there were other people who had preceded me and had children and just needed to understand it. So when I joined it, I benefited from the information they gave. And through that is how come I have stuck to it to make sure that the next mother does not suffer. Yes. According to the Ministry of Health, the statistics say that in Kenya, 14,000 children are born every year with sickle cell anemia. Now, these 14 children, we are not sure how many make it to the age of 5. Because you realize that between age 0 to 5 is when the child's immunity is building. And this is the time that the child is also at risk of infection and many other things. So for those living with sickle cell, their health is a little bit compromised. So you can imagine there's this anemia fighting you, and then besides anemia, there are regular infections, and these infections are wide. There is pneumonia, there's vomit and diarrhea, there's malaria, and many other things. So when they get this child and the child is already anemic, how fast can this child recover from this with the current health systems? So these are some of the things that have made many of our children not see the age of 5. Now, when these children die, nobody goes to record that this child had an underlying condition called sickle cell. It is recorded, died of malaria, died of pneumonia, died of vomit and diarrhea, and many other things. But nobody gets to actually understand what could have been the underlying cause.
This is dangerous because the country, or even the nation, even the health sector, will not have a direct data on what's happening and at what extent they should go to prevent the spread of, the sickle cell anemia in the country.
And that's why we are working in partnership with the government, where we are saying, yeah, we appreciate this information is available, but can we dig deeper? Can we do newborn screening?
Yeah.
Newborn screening is where a child is born, and the first 6 months may be hard to detect if they have sickle cell. But after 6 months, you can then do a confirmatory test that confirms that this child has sickle cell. Now, there are families who have multiple children. And remember, for a child to be born with sickle cell, the father and the mother must have the gene. So you can imagine, I am a carrier, my husband is a carrier. We can as well have children who don't have sickle cell or do not present the symptoms of sickle cell, simply because sickle cell anemia for 2 carriers, there is 25% chance, 1/4, for that child to have sickle cell. Then there's the other 1/4. The child could be normal, no trace of sickle cell. But then there's the 50% chance the child could be a carrier. Now, for families and households, like I tell you, my firstborn has sickle cell, my secondborn is a carrier. Thirdborn, I didn't even want to venture into that because I was afraid that maybe if I got another child, the child would have sickle cell. And this is a probability. So in this probability case, many families are living as carriers, having children with sickle cell and others not having. There are families that have...
they are carriers, though they're unaware.
They're unaware. Nobody tells you until you get a child. A case in place is what we've just watched before this show.
Exactly.
The family of Mama Kevin. Mama Kevin has 4 sons. 3 out of 4 have sickle cell. Now, this is 1 out of 4 for every child. So these 3 boys have sickle cell. They have to go through the motions of care, management, regular hospital visits, even being careful with their diets, things in moderation. So this is a family that is already so strained. Now, with a genetic disorder, nobody chooses. You find yourself in that space. Now you can imagine you go to the hospital, the bills are at the highest.
I'll get into that, the cost of treating sickle cell anemia. But before we get into that, what are some of the earliest chances or symptoms for young mothers? Because you say between the age of 0 to 6 months, it's so hard to predict or even to see whether a newborn has sickle cell anemia. We have got some young mothers who probably may not understand how it happens. What are some of the symptoms? What are some of the presentable signs that a young mother or a new mother can easily see that my child is presenting such kind of symptoms and therefore should take quick action?
So some of these early symptoms are, 1 is the child may start presenting with yellow eyes. I don't mean the black one, but the white of the eye
turns
is yellowish. So half the time you look at them, sometimes it's yellowish, sometimes it's deep yellow, sometimes it's light. That yellowness is one of the symptoms. When you go to the hospital, they call it jaundice. The other thing is you left the house, the child was playing, they were fine. When you come back, the child is in so much pain, and the pain is on the hands and feet. So the swollen fingers, or on top of the fingers here, or the swollen toes, or on top of the toes. And the child can't step. And
He becomes frail.
Yes, you start fighting. Who beat my child or who dropped him? So that is another symptom. The other symptom is when the child is crying, but there's no sign of pain. And you're wondering, why is this kid always crying? And you may have understood maybe out there could be a history of sickle cell. The other thing is when this child plays with other children but is not so strong like the others.
Exactly, he's a bit frail and
So they run for a few minutes and they're really tired. Then the other thing is when you go to the hospital for checkups and you find that every time you go the child is anemic. Those are some of the first signs that any mother should look out for. And then you also look out for the family history.
Which is very important.
Very few people know about their history. I got to understand my family history after my son, simply because I never thought it was important. But then these stories that our grandmothers used to tell us, about, oh, I had 5 children, they died before maybe your father or your mother was born. Those are things that should actually lift your antenna and tell you something could have been wrong. Maybe we should investigate what could have been the main cause of that.
I'm trying to imagine that perhaps that's the same thing that you also went through, with your 2 sons. But then at the end of the day, there is that turnaround in terms of treatment and awareness. What is the government doing to create that awareness across the country? Because at the end of the day, a person might not be so much willing to present him or herself to the hospital for treatment. But that bit of awareness either from the caregivers, from the NGOs, or from the government at large is what is needed.
Yes.
Where are we?
Yeah, there's quite a lot happening in this country right now on sickle cell. I'll say when I joined, it was not as strong as what we have right now, but it's still not enough. So what is happening is right now, county governments of most areas which are mostly affected, I'll tell you, you'll find more sickle cell cases in malaria endemic zones. If you go to the coastal region or go to the western bloc where there's malaria, you'll find many cases of sickle cell. And these are the counties who are currently now looking deeply into how do they mitigate that. So we have, just a few weeks ago, we had Migori County sign an MOU where they want to start taking care of their patients because they've realized they have many cases of sickle cell, but people are not coming to the hospital. There's no awareness. We have, yesterday we were fortunate, we signed an MOU with the Nairobi County. Nairobi County, we have many cases of sickle cell. Why? Because of rural-urban migration.
What is the rate right now? In terms of data, the numbers?
The numbers I will not be able to present right now. I have to rely on the Ministry of Health to give us that. So you find that there are many cases again in Nairobi. And then you go to a place like Kisumu, which is right now trying to even do more. Kisumu right now have the newborn screening, and they're coming up with many other policies to help in management of sickle cell. And also, we are working with community health volunteers. These are the right people because they live with these people in the community. And these community health volunteers, we've worked with a few in Mombasa, Kisumu, and we are also trying to spread to other counties. Homa Bay is doing something. Siaya is. So, and Busia. And all these counties are where you find many cases of sickle cell. So it is about the government also giving more to these county governments to manage the sickle cell disease. Because as much as there's a facility, how many are they seeing in the facilities?
Exactly.
We need that data.
Yes.
How many are attending clinics regularly? We need that data. Now, we have places where it's on personal belief that's also interfering. We have people who have churches that block them from visiting the hospitals. We have people who have the shame of having the disease. Coming
denial.
out, yes,
denial. That bit of denial.
Yes, coming out in public and saying, I have the disease. And there are many other things that are hindering people from going to the clinics. So even as much as the government is doing its part of trying to create institutions,
there is that piece of personal initiative.
Yes, we are talking to the persons affected. And I'm not just saying the person living with sickle cell. Affected. I am a mother, I am affected. Can you regularly visit the hospital so that the hospital knows you exist? Because it cannot only be that when you're sick is when you go. That is where now we get misdiagnosis. The child died of malaria. But maybe the underlying condition, what accelerated it could have been sickle cell. So creating demand from the public is through using the community health volunteers. There are also support groups across the country. Nairobi, we have a number, and all other parts of the country that also talk about sickle cell. Affected persons coming together and saying, how do we come out strong to advocate for our condition?
Do adults also get sickle cell? Can somebody get sickle cell at, some advanced stage
later in life?
Exactly.
Not possible. When you're born with characteristics.
Yes.
And this genetic...
It's all about the gene formation.
Yes. It's a blood gene that is affected. Somebody like myself, I have one normal blood gene and one abnormal one. So I have 2 blood genes, and every person has 2 blood genes. Now the 2 blood genes you inherit from your father and mother for you to have the 2. Now, what happens is that for somebody like me, I have one normal blood gene and one abnormal blood gene. My husband has one normal blood gene and one abnormal blood gene. Our firstborn inherited my abnormal blood gene and the father's abnormal blood gene. That is how come he has sickle cell. So there's no case where you will say sickle cell came from mom or dad.
Yes.
Both parties contribute.
Yeah.
Yes.
So the misconception that you can get sickle cell at an advanced stage in life does not happen. Okay, let's talk about the geographical area. You've talked about Nairobi, Homa Bay, Kisumu, and mostly, the regions in the, Lake region and the belt. Does it have anything to do with the geographical location?
Right now, I wouldn't say that. During diagnosis for my son, the question the doctor asked, what is his surname? And when the surname was given as Ogweno, she said, test for sickle cell. Personally, I was offended. I was like, what has a surname got to do with the disease? But then, looking back, that was the closest, because remember, there was a time in Kenya, people used to marry inter-tribe. Today, we cannot say sickle cell is concentrated on specific regions.
Yeah.
Because of intermarriage, because of interrelations, we have sickle cell everywhere in this country. Just that the concentration varies per region. There are areas where you'll find more cases than other areas, but in the entire country, there is sickle cell.
There's sickle cell. I'm trying to look at the cost of treatment. A majority of the hospitals, probably, I want to believe that it's very expensive to start treating sickle cell from the moment you realize that one has sickle cell until, because it's somebody who is going to be under your care. How expensive is this?
It's expensive because we've not invested in it.
Because we've not invested in it.
And I insist on that.
Yes.
I stand to be corrected by experts from all over the country. Diagnosis of sickle cell is very expensive. Diagnosis.
It's not just going to hospital and today I want to check on my blood group and that's it?
No, it's nowhere close to that. Diagnosis of sickle cell means this. I've already told you about the symptoms. My son presents with swollen feet, swollen fingers. I take to the hospital. The doctor tells me, go do this test and bring the results. Because within the facility, they don't have the diagnosis machines. So when you go out there, the diagnosis of sickle cell mostly is done in private facilities. And those private labs will charge between 4,000 to 10,000. For somebody who lives in a slum setup, where do you get 10,000?
It's not financially stable.
And we've had cases like that, where they will only go and come back only when the child is sick. So who is suffering? The child. They cannot diagnose. So you always treat the symptoms, but you never get to get the underlying problem. Most of our county hospitals don't have diagnosis machines. And therefore, they have to send it to other labs who support that. The other thing that makes it very expensive is where the facilities need to be well equipped. The infrastructure. It's not only diagnosis and you stop there. There are other things that, because it's a blood disorder, a blood problem, you have to go into things like the organs. They require blood for you to function. Your entire body from head to toe requires blood. So when it comes to testing your liver, testing your heart, testing your kidneys, we need special machines. But this becomes very expensive. So managing it also becomes a bit expensive. These people develop complications with time. Some end up having hip problems, where the hip degenerates, and therefore they have to go for surgical procedure to correct that. Some of them develop wounds that don't heal.
Because of the blood.
Poor circulation.
Exactly.
Yes. Some of them just develop problems from the heart. Now, for you to manage this person with those complications becomes very expensive because it requires specialists. But if you start early from diagnosis, go to that facility. Every month you go for checkup. You are given your regular medication. It delays those complications. For some, it even becomes better because then they don't have to even get to the complicated part.
But Selina, much as, you know, you're really putting it in such a way that the common mwananchi cannot afford.
Yes.
But what is the bare minimum for that person who may not be in a position to do monthly medical checkup, or depending on the seriousness of the patient, what's the bare minimum a one, you know, caregiver can do, or even a patient can do in this case?
In this case, the first thing that I would recommend is let's create demand in these facilities.
Yeah.
If I go for regular checkups and they see like 50 people every month coming in with the same condition, I'm sure it will wake them up to say, okay, fine, let's just give them this much. And I say this from experience. We have a facility within Mathare that we just decided, let's create the demand. And what was the demand? We have sickle cell we want to be taken care of. At that point, they didn't have a diagnosis machine. At that point, the medications were not everything that we needed. But since people used to come there regularly, today the facility has a diagnosis machine, it has regular medication, and patients are going there on a regular basis. Now, when you go to a rural setup, it is totally different, because this is a, let's talk of an illiterate mother or grandmother bringing a grandchild and telling you this child is always sick. You want to treat this child and you tell them, these are the tests I want you to do.
Exactly.
Where will she go? She'll go back home. Some of them even lock these children in the house.
Yeah, because of the shame.
Some are even advised that don't invest in this child. Let the child die because they are anyway going to die.
Sad situations there. And sadly, there are people who take such kind of steps.
Exactly.
There is this bit of mitishamba. You know, people doing all manner of things. You know, somebody saying that, you know, I want to direct you to a certain person. You're going to take the concoction, drink it twice or 10 times a day, go and do blood flushing. Some people say that, you know what, you have to go and see a doctor. Your blood is going to be drained. You're going to be given another pinch of blood. These are some of the misconceptions. But number one, mitishamba, the traditional type of treatment, does it work on sickle cell?
Wow. And it's a question we have every day.
Okay.
Now, mitishamba, anything that we cannot control from the laboratory, I don't think it's safe to take. We have people who go for those concussions, and every day they come and say, this worked for me, this didn't work for me, this, like that. But what do we use to measure that it worked? Looking at you like this, will I know that you're okay? Better than yesterday? You telling me I'm feeling great, does it measure how you're feeling? So mitishamba exists, and those people exist. And there are families that are actually stuck to it. But what I would recommend, use a health facility to just measure how you feel and how these different components are working on you. I could be taking a mitishamba, but it could, in the process it's overloading my kidney, and I don't know. But I'm feeling great. And I tell people, you know, since I started taking this thing, my blood levels are high.
I'm good, I'm doing fine.
Until one day you develop a complication because the control of that particular mitishamba was not there. So for anybody who wishes to use any traditional method to treat sickle cell, remember the hospitals are there to help you put you on check. Go for those lab tests and just say, I want to know how my liver is, I want to know how my kidney is, I want to know how my blood is responding to this. And through that you will be guided by a professional if to continue or not.
Absolutely. Wow. Okay, there is that bit of myths and stigmatization. A majority of people, the way you said, they'll rather lock their kids somewhere. They're told this child should not walk in the sun. I don't know how many people, this child, because of the shame from the public, from members of society, lock them up. That aspect of stigmatization, how do you deal with it as an organization?
As an organization, the first thing we have found, which is the best of opportunity we've had on the ground, is community health workers.
Yes.
You know, for a very long time, we never knew them. But the day we discovered community health workers, they have actually taken care of a lot of that burden, because the community health worker lives with these people in the community. The community health worker are attached to a health facility. So whenever they find that there's a child who is being denied their right to live, or their right to education, or their right to anything, they are able to follow the channels to report it and find this child to get help. Now, the other thing that we did differently in Nairobi was we trained the administrative leaders, those are the chiefs, and the community elders. Because we realized that when that community health volunteer sometimes goes to these homes, they face hostility. But each and every community has the elders who can be called upon to support or just try and advocate for this child. So whenever they face a problem, we pointed them out to their area chiefs. Please go to this person and report this case. And the area chief then comes with his intelligence to help rescue the child. Now, we talk about the community, that's fine. Let's talk about the workplace.
Yes.
The workplace becomes a very hostile place for most of these people. There are many young, brilliant people living with sickle cell. And when I say brilliant, these are people who score good grades in school and in universities, but they can't get employed simply because they have already been stigmatized. The people look at you like, this one is always sick, so they cannot do it. This one is not as strong, so they cannot do it. I ask employers to give them an opportunity. You don't know what you're missing out on these young people. And this has led to a lot of depression. We are dealing with a lot of mental health for the young adults living with sickle cell because they're denied opportunities, yet they're capable of delivering. They get sick, but yes, they can get very sick. But when they get well, they come back with the same energy to give back.
Yes. Let me ask you this question. What is the Kenya's global standing in terms of fight against sickle cell anemia and infection globally? And I know it's a global kind of stand that many countries are battling with now that it's a genetic kind of disorder. But where are we as a country in terms of steps, you know, the mitigation? Where are we?
I wouldn't want to say we are far ahead. We are still behind in many things because our facilities, as I've mentioned, are still not well equipped. Our healthcare providers are brilliant people, but they need refresher training regularly to get them to that place where they can manage even complicated issues. We need our healthcare providers to be given a platform for research and also a place where they can now deal with sickle cell as a disease in terms of there's cure for sickle cell, bone marrow transplant. But in Kenya, we don't have a facility that can confidently say we are going to do 10 bone marrow transplants this year. And if you get that bone marrow transplant, it's so expensive.
It's very expensive.
You can't just advocate anyone to go for bone marrow transplant. Now, as a country also, we are at that place where we are also in talks with other countries, comparing our levels. Within Africa, I think West Africa is way ahead because they've done a lot of advocacy and the awareness levels are high, and that is a place where there are certain steps they've taken up even as policy. Our neighbors as Uganda are also doing quite well, and Tanzania, where they've provided platforms for those healthcare workers to do a lot. Now, in the place of where do we see ourselves, there's a lot of potential. Just that potential is not tapped to the level where these people can be elevated to where they're supposed to be. We have many young doctors coming in every year, but where do they go? They will go for other things that maybe are already set up. But the sickle cell space is still not well set up for people to find it that it's an attractive line of employment.
As you come to a close, let me just ask this question. So if someone has a sickle cell anemia, that's not a death sentence?
No, it's not. They live to old age. These are people who have children. Children who, of course, if a sickle cell person was to get married today, my advice is go and get somebody who does not have the gene. So if you two have 2 normal genes and the other person has 2 abnormal genes, for every child you get, it's a carrier. Now, with carriers, I'm a carrier. I have full potential to do everything. So, but that is not only the thing. The thing is education. Can we make informed choices so that we are able to get to a place where we can also be given an opportunity to build this country. Before I finish, there's one thing that has affected us over the years.
Briefly.
The education system came in and decided that when people clear class 8, they're selected to schools. Our children are scoring 400 plus, so they're going to national schools and very good sub-county schools. But then a child in Nairobi is called in a school in Kisumu, but the parents are in Nairobi.
Yeah.
The child has worked hard, they've done their part, but then we are not given an opportunity to choose the school. Can we give our children an opportunity?
That's now children with special cases.
So long as I live with sickle cell, can I have somewhere where I tick that I live with sickle cell, so that when school selection happen, I am selected in a school near where I get care and not so far from my family.
Yeah.
We've had cases where we've had to now have to go, the child has qualified for national school, but we have to downgrade them to a sub-county school because of that.
Yeah. All right. Thank you so much.
Thank you.
You know, one thing that you've told me is that at the end of the day, sickle cell anemia, if once you have it, it's not a death sentence.
No, it's not.
And stigmatization is one of the biggest killers.
Yes.
It's not even now the sickle cell itself. It's the stigmatization and depression that come with it. Absolutely. Thank you so much for joining us. You know what? I said, all right, we do politics, but at the same time, without good health, we can't do this. We've been talking to Selina Olwanda, who is the chairperson of Children Sickle Cell Foundation, and she's doing an amazing job. Continue doing that. This is a discussion we'll have some other time. Please continue doing what you're doing.
Thank you so much.
All right, that's where we end it. Thank you so much for being a part of the show. That has been part of Good Morning Kenya. Let's wind up at that particular point on behalf of everyone else. My name is Victor. Have a good morning. Bye-bye.